Good afternoon, everybody. Welcome to the City of Toronto COVID-19 media briefing for Friday, May 29th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Saad Rafi, S-A-A-D, R-A-F-I, who is the city's Chief Recovery and Rebuild Officer. Mr. Mayor.
Well, good afternoon, and thank you, Brad. We are continuing to fight COVID-19, as you know, and we're working hard to stop the spread of this virus in our community. It's now been 11 weeks since we took unprecedented steps to lock down the city to protect the health of the residents and to save lives. We've started to slowly restart the city and the province, but it is clear this will take time, and it is clear, I think, that it should take time in the GTA in any event if that is what public health indicators require. We know we will need a strong restart and recovery to help rebuild our city's economy, and that will make a huge contribution to the rebuilding of the national economy. Many people have worked throughout this pandemic on the front lines of our healthcare system, providing essential services and in essential businesses that had to keep operating. But many people, hundreds of thousands, as you well know, have been working remotely or, in other cases, not working at all. Before the pandemic, people took, for example, 1.8 million TTC trips on an average weekday. Right now, we're seeing an 80% drop in our TTC ridership. Furthermore, the TTC has made it clear that as ridership starts to increase again, the ability for people to physically distance themselves in transit vehicles will diminish very quickly. This will be one of our biggest challenges of the restart and post-COVID Toronto. And that is why we are strongly recommending that people wear face coverings when using the TTC. This is why we approved active TO bike network expansion and acceleration yesterday at the City Council, so as to give our subway system a safety valve and give our residents another alternative way in which they could get to work. And that is why Saad Rafi and the Toronto Office of Recovery and Rebuild have been working with businesses and with institutions and other large employers in the downtown to talk about their workforce plans in the coming months. There are people who will absolutely have to come to work to do their jobs. But we know some other people may want to work staggered hours, or there may be people who need to work staggered hours, and we know there are many people in many organizations who have been successfully working remotely from home for months, and that telework could continue, and indeed may need to continue, to be something that is very much prevalent in the best interest of a gradual return to normal. Such an approach will help take the pressure off our subway system in the downtown and help ensure that we have a slower, steady, and safe restart. And that is what we absolutely must have. Yes, for some logistical reasons, but driven mainly by public health considerations and the important challenge of getting the speed of the reopening and the return to work, getting both of those right. We do not want the sacrifices that all of you have made out there to be in vain. We do not want to have to go back to a more stringent lockdown. We want to do whatever we can to minimize any second or third waves of this virus. That's why today I am announcing that the City of Toronto and a number of the city's major downtown employers besides ourselves, because we're a major employer as well as Toronto's post-secondary institutions, will continue to support a majority of employees, where possible, continuing to work from home until September at the earliest. Mr. Rafi and I have been engaging businesses and institutions and communities and city divisions and partners to learn how we can best recover from the impact this pandemic has had on all of us. Telecommuting, phasing in employees' return to work, and staggering start times where possible will help businesses to maintain physical distancing. It will help keep their workplaces healthy, and most importantly, it will reduce pressure on public transit as more businesses and institutions resume more normal operations. On the daily start time side, having some people start, for example, after 9 o'clock in the morning fits a quieter time on public transit and may even fit the sleep patterns of some Torontonians. The TTC is currently operating at approximately 20% capacity. We can continue to maintain physical distancing on the TTC up to 30% capacity. So that means an additional 180,000 people per day. Finance and insurance company employees for example, account for about 12% of all public transit commuters into the city. So that's more than 50,000 of them using transit as their main mode of commuting to and from work. And over half of the students at Toronto universities and colleges also commute every day by transit. Now, it's not just the commute to and from work that we need to address. We know many workplaces are reassessing physical layouts of workplaces to comply with physical distancing. They're looking at access to the workplace, things like elevators, determining how to safely meet with customers and clients, and adjusting shifts and business hours, and reviewing workplace policies and procedures. By delaying and phasing in the physical return to work and school at some of these major businesses and institutions, and by staggering daily start times, for example, we are finding ways to live with the continuing threat posed by COVID-19. The City of Toronto is one of those major employers, and we will continue to prioritize remote work and delay the return of a significant number of our employees to the city's normal workplaces. I would like to acknowledge the following major employers who have stepped forward to join the city in supporting this gradual and proactive approach to reopening. And I'm going to list them because I want to thank them for the fact that they have been so cooperative with Mr. Raffi and myself in answering this call. Bank of Montreal, Canada Life, Canadian Imperial Bank of Commerce, Centennial College, Deloitte Canada, EY Canada, George Brown College, Humber College, KPMG Canada, Manulife, National Bank, OCAD University, PwC Canada, Rogers Communications, Royal Bank of Canada, Ryerson University, Scotiabank, Seneca College, Sun Life Financial, TD Bank, University of Toronto, Yamana Gold Inc., York University, and Zurich, Canada. As mayor, I want to thank these businesses and institutions who have signed up already to work with the city on this effort. And I look forward to continuing to work together on future efforts that will help all of Toronto to recover and reopen safely and as quickly as possible, but always placing public health first. This is a good start, but we are now, as of today, calling on other corporations and organizations, other employers, to make this commitment as well. We need all hands on deck in this effort to keep our city moving and working through the restart and recovery period, but doing it with an eye to being sensitive to some of the challenges we face in the recovery and restart, and always with an eye to public health. This unprecedented cooperation by these corporations and institutions represents good citizenship on their part, but it also shows how we can truly confront COVID-19 and make sure that our city and its economy come back stronger than ever. This economic restart cannot stall. It must not stall for the benefit of Torontonians and our city and our country. It is too important to all of those places and all of those people. But thanks to the partnership and the cooperation of other partners who I know will step forward, I know that we will get this right. I'm inviting other large employers who are willing to work with us on managing dates and times of return to work to contact my office or Mr. Raffi's office to see how you can join in. Now, as we go into another weekend, I want to stress that we need your help, as we have all the way along, in this fight against COVID-19. We've urged the province to test as many people as possible so that we can work with them to track this virus to the best of our ability and to stop it from spreading. And I think we heard some encouraging news in terms of expanded testing today from Premier Ford. We have significantly expanded our available resources at Toronto Public Health to get that important tracking work performed by the local health unit as quickly as possible. We've opened up our streets through active TO. We've opened up some parks amenities so that people have space to get outside, but to make sure they keep their physical distance. But we do need your help, as we always have, and we need to have you continue doing the good work you have been doing to keep this deadly virus from spreading. Please keep your distance from others. I know it can be tough. Please stay home as much as you can and only gather with the people you live with. Now is not the time for backyard barbecues or neighbors or for a party in the park, not just yet. Please wear a mask when you go grocery shopping or into other stores. If we all do it, it will help people from unknowingly spreading the virus to others. And please be considerate of your fellow Torontonians. Find ways to help us to support communities which have seen more of a prevalence of COVID-19. Some of them are making a huge effort to make sure that that virus doesn't spread, but they need our support in many different ways. I know some communities were upset by the geographic data released by Public Health this week. We made that data public, all of us in government here at the city, so people would have these details and better understand the impact of this virus on our community. And we are using this information to help people by coordinating and focusing our efforts to fight COVID-19. Our posture should be to reach out and support, not to look down. And I think extending that support is something that Torontonians are doing. It is just something that we do. Be considerate as well of those who are wearing a face covering or a mask. They are being respectful and considerate of you and of your health by wearing a face covering, and they are deserving of gratitude and respect. And be respectful of businesses who ask you to wear a face covering if you're going to enter their premises. That is their right, and I urge people to be respectful of that. It is also consistent with the advice of Toronto Public Health. We're all in this together, as we've said many, many times, and it's just true. It's true. In Toronto, that is at the core of how we live, that we're all in it together. And now is the time, more so than ever, to support each other. And on that note, I will ask Dr. de Villa to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 175 new COVID-19 infections in Toronto. To date, 8,086 people have recovered, an increase of 142 since yesterday. As always, for more detailed data on the status of COVID-19 cases in our city, I would ask that you please visit our website. COVID-19 has changed how we live and how we work. It has now been more than 2 months since we asked businesses and other employers to help staff work from home where possible. Given the close proximity of people in many workplaces and during their daily commute, this was a critical step in reducing the spread of COVID-19. It also helped us keep essential frontline workers safe. I would like to echo Mayor Tory's message of thanks to all employers who have committed to continue their work-from-home programs for their employees. I also sincerely thank everyone who has made the necessary adjustments to work from home. I know it has been challenging for many people, but your collective efforts are helping to protect the health of our city. COVID-19 has launched many of us into suddenly working from home. This has been a new experience for many of us, especially for a prolonged period of time, and with an added layer of complexity for those who are also managing childcare and virtual online learning. Others may be sharing space with their partner, with their family members or roommates who are also now working from home, sometimes in small spaces. These are certainly very different routines. While there can be many benefits from working from home, such as more time with family and no commute, it is still an adjustment and a change in our routines. To mark the end of this work week, I checked our city's occupational health and safety tips for teleworking and thought that now would be a good time to offer some advice for staying healthy while working from home. First, create a consistent routine and keep a structured work schedule to help keep you focused. Occupational health experts recommend maintaining a consistent sleep schedule to make sure that you're getting enough rest. They suggest aiming for 8 hours and trying to get up at the same time every day. Sharing childcare duties if you have small children and are able to share, and consider splitting the day with your partner. Having a regular morning routine, including getting dressed for your day as if you were going to the office. Taking a break and getting up to stretch and move around every couple of hours. Get outside for some fresh air and sunlight, and consider setting a timer if this is helpful to you. Eating well, drinking lots of water, making sure that you have healthy snacks, and trying, of course, to eat your lunch away from your computer. And finally, maintaining or starting an exercise routine to get active. Increasing opportunities for daily physical activity have positive impacts on our physical and mental health. While many of us may not have an existing workstation at home, it is important and advised to create a designated work area in your home that is free of clutter and minimizes distractions. Our occupational health experts suggest that you should avoid working from your couch and sitting in awkward postures or positions that this would promote. They also recommend that in order to maintain good posture, use a chair with good support or use a rolled towel or a cushion for back support. It's also important to ensure that the top of your computer screen is at eye level. Finally, it is important to incorporate movement into your day rather than staying seated all day. Stretch intermittently throughout the day, and again, consider setting a timer to remind you to get up and move. Stand up while speaking on the phone, and try to get out of the house and get out for a walk at lunchtime or at another time during the day. I do hope that everybody who is working from home might find some useful tips out of this advice that I've just provided. For businesses that can operate with employees at home, this will be the new normal for a while, so it's important to make sure that we're setting ourselves up for success. As we gradually move towards reopening our city, it is critical that we all continue to do our part to drive down the rate of new infections. To do this, a number of public health measures will remain in place for the foreseeable future, and your individual contributions continue to be central to our success. So please, I ask that you continue to wash your hands often or use an alcohol-based hand sanitizer. Keep 6 feet or 2 meters distance from others. If you take transit or are shopping in person, do your best to keep that 6-foot physical distance from others and wear a cloth mask or face covering if that distance cannot be reliably maintained. Continue to work from home if you are able. However, if your job requires you to be on site, I ask that you be extra vigilant about hand hygiene and physical distancing. Please remember that all your efforts are worth it. You are saving lives. Every action you take brings us one step closer to getting our city back. The forecast looks promising this weekend, so I ask that you please go outside to enjoy some sunshine, some fresh air, and some exercise. Whether you walk, jog, or cycle, I encourage everyone to take advantage of the active TO spaces our city has created for you to safely enjoy. And once again, I would ask that you please remember to practice physical distancing and stay within your household bubble when you go outside. And please continue to take care of each other. I'll now turn it over to Mr. Rafi for his remarks.
Thank you, Dr. de Villa. Good afternoon. The Toronto Office of Recovery and Rebuild was established in late April, and I'm working alongside Dr. David Mowat, who is leading the public health strategy side of the recovery effort, and with Dr. de Villa. Our efforts are focused in 7 areas: city division and agency preparedness, resilience and climate change, community and vulnerable populations, strategic alliances and partnerships, government and financial renewal, businesses and culture, and Inspire Toronto. Since the outset of the pandemic, the city has received input from residences and businesses, including through the Mayor's Economic Support and Recovery Task Force. This feedback has helped shape the city's response to the crisis and will shape future actions to recover and to rebuild. The Toronto Office of Recovery and Rebuild is continuing that engagement with our communities, partners, residents, and businesses to get a diverse perspective on how to support the recovery, rebuild, and the reimagining of Toronto. The information gathered will be used to help inform the city's decision-making around how Toronto can move forward and come out even stronger. Toronto's recovery and rebuild will be guided by the advice and direction of public health officials. Ensuring the health and safety of all residents remains the city's top priority. For this reason, the consultation will rely primarily on online collection of input to maintain physical distancing and limit the handling of paper forms. A website has been launched at toronto.ca/recovery-rebuild. The website contains a survey as well as tools and resources to encourage discussion and to help you host your own virtual conversations with your friends, neighbors, colleagues, and associations. We invite your feedback on a number of questions, including what are your priorities to effectively recover and rebuild? Your creative ideas that you've seen or heard of in response to the pandemic that we can deploy here in Toronto and build on. Your thoughts on how cities will need to change moving forward. And any actions you would like to see the city to help you move forward and all of us move forward together. So please, visit the website to complete the survey. We're asking that you do so and put your responses in by the end of June, June 30th. Again, the website is www.toronto.ca/recovery-rebuild. And if you require the survey in a language other than English, you can call 311 for interpretation assistance to complete the survey or to provide your thoughts. Thank you.
Thank you, Saad. Before we go to questions, just let reporters know that on the line as well, staff on the line are Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care. First question is to Matt Bingley from Global News. Hi, Matt, go ahead.
Hi, good afternoon. Mr. Raffi, on the plan to extend work from home until September, could you describe how difficult it was to get companies and institutions to buy in? Were there any holdouts? And is there a possibility you may be required to ask them to extend this request again?
We found a high degree of cooperation. As the mayor said in his remarks, these companies themselves are having to make plans with their landlords, or if they own their own buildings, from all manner of things, from elevator access. You know, it wasn't that long ago that we were moving to a co-working regime where team-based models were the way to go. So now they have to reconfigure, if I can put it that way, that office space to allow for physical distancing. These things take time. And I'd also point out that it's quite likely that these organizations would be in stage 3 or phase 3 of the province's restart and reopening. So I think that they were quite willing and able to participate and sign up.
And Mayor Tory, earlier today you said that you were looking into the legality of requiring transit riders to make it mandatory to wear a cloth mask. Can you just say or tell us what those legal issues would be? And for the people who can't afford a mask, is the city looking into the possibility of supplying them for transit users?
We haven't got that far. What we thought would be responsible, just in the context of making sure that we look at all available options to ensure the highest possible adoption of a face covering or mask on the transit, was to look at what legal authorities or powers were held in various places to do that. And so that's the exercise that we've been performing, knowing that you have to keep that option available to you in order to try to increase the usage. And we haven't really addressed the question of if such an order were to be given, depending who it's given by, how you would make sure that everybody had a mask. But I think now we've got the availability even of masks people or face coverings people can make themselves, or even a scarf that's properly worn for this purpose. So I think most people would find themselves in possession of something that would be satisfactory for the purpose for which it's intended.
Okay, thank you. Go next to Mark McAllister from City News. Go ahead, Mark.
Mayor Tory, earlier today, Premier Ford said that he's now willing to start reopening on a regional basis. Obviously, you've been asking for at least to slow things down to this point. I'm just curious, now that you know that he's open to the idea, how you would like to see this happen for Toronto specifically, if you have any specific ideas that you've been discussing with the province.
My ideas have always been consistent on this, which is that I think you would do everything and you would do anything, and what you would do perhaps slower or faster than somebody else will depend on the public health numbers. This is always the point that we've been making, and the Premier, I must say, has been most eager to listen, and I've had good conversations with him about this, which is that we have a different situation here because of the size of the population. Even just taking the fact we have the only transit system in the country that has 1.8 million riders per day when you're in more normal circumstances is by itself a reason why you have to be very careful in going about reopening the economy. And so I think that there's a way in which this can be done where perhaps on a given day he'll say that these things can be open in the province as a whole, but that there's some degree of local latitude based on the advice of our own medical officers of health, say in the GTA, that we can speed that up or slow it down depending on what we think is appropriate. And I think that's that kind of consideration given by him, I think, is most welcome.
Just to follow up on that, the idea of a survey, Mr. Raffi, being posted on the website and seeking feedback, engagement. Throughout this entire ordeal, much has been done without necessarily going through that process with the public. The need to do things quickly without necessarily consultation and public feedback necessarily. Why do you feel that there's a need at this point when we're still dealing with everything we need to reopen, or at least there's a push to reopen quickly?
I'm sorry, I didn't hear the last part. There's a push to?
Just to get things back to normal as soon as possible.
Well, a couple of things. I think the residents and businesses of the city are probably the best people to provide input on how the city can improve its services. And this is also about the rebuild and reimagination of what the city needs to do in order to be a better provider of services for its customers, if you will, the citizens of the city. And so that's why we wanted to have a very broad outreach, so businesses, organizations, and individuals themselves. And the recover aspect of this is also something that I think is necessary to hear from those organizations and businesses, because they themselves know what they need. We should not be predicting what they need. In the response approach, absolutely. Action had to be taken quickly, and it was taken with great care. But we think that there's a need to get feedback and input in order to come up with recommendations and actions.
Great, thank you very much. Go now to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. I just got one question for Dr. de Villa. In regards to the online neighborhood map of COVID-19 cases, can you talk a little bit about what happened with the error with the numbers in Bruges?
Yes, I can speak to that. You may have noticed that we put up the data on Wednesday afternoon. Shortly after those data, that map was put up, it became clear to the team at Toronto Public Health that there were some errors in respect of the map. So the map was taken down, the issue addressed, and the map was then subsequently reposted. And the issue had to do with the way the data were pulled from the data source in order to place them on the map. And without getting overly technical about it, in order to place data on the map and to locate the cases on the map, it required the use of a file that contains the postal code information. And there was a technical glitch with that particular file which created the problem and effectively overcounted or gave rise to numbers that were too high for certain neighborhoods. So that was that technical glitch was addressed, corrected, and then the corrected version of the map was then posted. And our staff are being very, very careful around ensuring that the files are well managed and that glitch is addressed in the postal code file so that that does not happen again.
Okay, thank you. We'll go now to Michelle McQuaig from the Canadian Press. Michelle, go ahead.
Hi, Mayor Tory. A couple of questions, not regarding COVID-19, but having to do with the death of Regis Krasinski-Paquet. There's a protest that's in the works for tomorrow. Organizers are anticipating several hundred people, and they're there to protest black racism and anti-Indigenous racism. Sorry, can you hear me?
Now, you better now.
Go ahead,
Thank you.
Michelle. That's
Thank you,
better.
Michelle.
Thank you.
Yeah.
Sorry, okay, forgive me. My question has to do with the death of Regis Krasinski-Paquet. There is a protest in the works for tomorrow. Several hundred people are expected to congregate to protest anti-black and Indigenous racism, and I wondered if you had any reaction to the event itself, especially given in the light of what's taking place south of the border.
Well, I don't think, no matter which way you look at this or from what perspective or whose perspective, this can be seen as anything other than a terrible tragedy. And our condolences obviously go out to the family and the friends of this woman who lost her life. I think now it is important for us to let a system that is in place to provide for an independent and very thorough investigation take its course, to remain calm while that is going on. I hope that it can be done as quickly as possible because I think it's appropriate in the circumstances it should be. And I think in the meantime, of course, people have the right to protest, and anti-black racism is a fact in our society here. We may be doing better than some other places, but it's still a fact. That's why we have an anti-black racism unit here at the City of Toronto, the first of its kind in North America. And so we're on to the fact that this is a long-standing problem and something needs to be done about it. And I'm not tying that necessarily to any particular case at all, just the fact of that existence. And if that's what's being marked by a protest, then I don't think there's anything about that is other than perfectly appropriate in a democracy. But I think we need to have patience. We need to have calm while the people in the independent provincial organization go about seeing exactly what happened here and getting the answers that everybody wants. I want them. The family, most importantly, wants them. The police, very importantly, want them. The community wants them. And we will get those answers out of the investigation that's now underway.
On a related note, do you have concerns about the protest in light of the physical distancing measures that you're all currently still recommending?
I think that everybody, whether they've been protesting or whether they've been, trying to be in a park or whether they've been out cycling, the vast majority of people have really done well at making sure they find ways to keep themselves safe and healthy and be considerate of the safety and health of others. And so I would hope that in any gathering like this, which is technically not in compliance with the current rules, that people will find ways, if they want to have a protest, of physically distancing themselves. It's in their own best interest and the best interest of all the people standing beside them and standing around them. And so I have great faith in the fact that people, can do two things at the same time and follow the rules, and I hope they do.
Okay, thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hi, everyone. Mayor Tory, I understand that OC Transpo in Ottawa has already said they're going to make masks mandatory partway through June. I just wonder if that's an example the city is looking at, and if you're aware of what legal concerns they may have had to address to put that in place.
We've been looking, and of course we're abiding by the advice of our public health officials, but we've been looking from the standpoint of the law at who can most effectively bring about such an order if one was deemed advisable by the medical officer of health. And so we've really been focused more on sort of who has the authority to issue such an order and how you would carry it out. And so we're watching obviously with interest what is being done in other cities around the world, including Ottawa, but no decision has been reached on that. At the moment, what you do have on the books very clearly from the Medical Officer of Health of Canada Ontario and Toronto is strong advice when you find it difficult to maintain physical distancing to wear a face covering. And of course, we've already said that after a certain amount of additional traffic on the TTC, that will become difficult, and therefore that is strongly recommending the wearing of a face covering. But the issue of a possible mandatory order, we've confined ourselves thus far to issues of the law and who could do that and what some of the consequences of that would be, but there's been no other decision taken as yet.
One of the issues that was raised by the TTC earlier was how such an order could be enforced and who would be responsible for enforcing it. So I wonder if that's also part of the conversation.
Yes, it obviously has been, because depending on who passes the order, whether it's a provincial order, a municipal order, a TTC bylaw, these are all legal options among others that could be used, then that speaks to the question of how it would be enforced and by whom. And these are some of the challenges. When you're dealing with, let's say, 1.8 million transit riders per day, or even a number smaller than that, but still it's a very substantial number of people, the question of enforcement becomes a very significant one. You'd like to hope you won't need to have a lot of enforcement in the context of people deciding it's in their own best interest and the interest of their fellow transit riders to wear a face covering, but these are the questions that are under consideration. And then it switches over to the larger or equally big question of do the public health officials advise us that this is something that should be done in the best interest of stopping the spread of this virus and making the transit as safe as it can possibly be, which is our objective, obviously.
Okay, thank you. Go to Derek Ian now from the CBC. Derek?
Thanks, Brad. So this first question is actually for Dr. de Villa. So the top emergency doctor at Michael Garron Hospital said today that he's disappointed in the contact tracing being performed by Toronto Public Health. He says that he's called about a high-risk COVID patient this week, but no one from TPH followed up with him for more than 24 hours. So is the city's contact tracing system able to keep up with new cases?
So I think when we're looking at our case and contact tracing efforts at Toronto Public Health, there's no doubt that we have a significant caseload to manage, and for each of those cases, they may have several contacts that need to be reached. We have certainly added and continue to add resources to our case and contact tracing teams, and we do have several of these teams. In fact, I've mentioned over the course of several of these briefings partnerships that we have had with the Registered Nurses Association of Ontario, partnerships that we've had with some other local health providers, including volunteers from the University of Toronto Medical School, amongst others. So we are certainly trying to bring the resources to bear. Now, what's interesting with respect to case and contact tracing is that sometimes the lack of success in terms of connecting with individuals isn't for lack of trying. It's just sometimes that you're not able to make the connections. So I don't know of the specific circumstances that the physician you're speaking of is addressing in his concern, but certainly this is a subject of regular conversation at Toronto Public Health, and we set fairly high standards for ourselves and are seeking to ensure that we are as timely as possible in following up with cases and identifying their contacts and ensuring that we're following up with them as part of our case investigation protocol.
And just to follow up on that, you touched on, the large caseload that you guys have to manage and deal with. What are some of the challenges that you guys are finding in this process, especially as people are going more outside into parks and whatnot?
Well, I think you're already addressing some of those very challenges that we run into. There are a number of different issues and a number of different points along the way from when somebody actually develops symptoms until we're actually able to identify them as a case and make that contact and follow up with all the relevant contacts. One of the issues that I identified at an earlier press briefing, for example, is that it takes people several days and a median of 3 days from the time that they actually develop symptoms until such time as they actually go and get a test. Those are Toronto data, relatively recent Toronto data, so we know that that's one of the challenges in making sure that there's a timely response. Certainly case numbers are part of that as well, and as you indicate, as people have greater contacts, greater numbers of contacts, there's just more to follow up on, and therefore that takes more time. That's why we're continuing to bring on additional resources And over and above bringing human resources to bear on the situation, we're also actively exploring a variety of different strategies that can be used. Better use of technology would be one example that we're trying to bring to bear so that we can make sure we're doing that very, very timely case and contact follow-up.
Okay, thank you. Next question is Jeff Gray from the Globe and Mail. Jeff, go ahead.
Oh, hi, thanks. You touched on this. Maybe I'll ask it just in a different way. Given that the province is ramping up testing, and we don't know how many more tests, they wouldn't say how many more tests they think this new strategy will result in. How much more can you ramp up contact tracing to keep pace?
Well, as I've mentioned already, we are adding more and more resources, both from a human perspective and also deploying technology. You're quite right. It will take a number of different strategies to address the situation, and some of them are about process issues as well. However, we're continuing to work with other partners. We have a good partnership with the Registered Nurses Association of Ontario. There are more opportunities to expand on that partnership with them and with other healthcare partners throughout the system. So we will do what needs to be done in order for us to achieve the objectives and to discharge our responsibilities and obligations in terms of case and contact tracing. Of that, I can assure you.
And to follow up on that, I mean, you and others and experts in the field and so on have been calling for much broader testing, surveillance testing, this kind of testing for weeks, months since this thing began. Is it too little too late now to have this testing strategy unveiled today?
No, I think it's important to articulate a testing strategy that helps us move forward as a province and in particular as a city and as the GTA writ large. I don't think it's ever too late, and I do think that what needs to be done is a constant reevaluation of what we're doing. So even as one develops a testing strategy, as the situation changes, one needs to change along with it. So we should anticipate that the testing strategy that's been unveiled should be evidence-informed based on what we've got currently, but we should also expect that that strategy and the approaches may change, and they should change in accordance with what we actually see on the ground.
Okay, thank you. Final question goes to Mark Douglas from 680 News. Hi, Mark, go ahead.
Hi, thanks. Mayor Tory, going back to the question of reopening the province on a region-by-region basis, based on the COVID-19 caseload in Toronto and the GTA, Toronto would certainly be one of the last, if not the last area to reopen. Would that be, in your mind, unfair to Toronto, or conversely, could you accept that it would be unfair to the rest of Ontario to wait for Toronto to clear up before everybody else can reopen?
Well, precisely the reason why you'd want to have a flexible arrangement, as the Premier suggested was a possibility today, is so that you could do what was right. It's about what is right for different parts of the province, and so I think what this implies is that if the health numbers here are different than they are in the rest of the province, perhaps we could take a different approach and be given the latitude to do so. This is all in the interest of keeping people healthy and making sure we don't slip back into another shutdown. And I think the people of Toronto, their view is to say, please get things open and back to quote-unquote normal as soon as possible, but please don't do it too quickly, because we certainly don't want to go backwards into what we've been facing the last couple of months. And I think giving a degree of flexibility to the GTA, for example, would be appropriate. And I think would cause a little bit more sacrifice, but in the long run, I think it'll be a very good investment of some additional time to make sure we get this right, which is what I think people want us to do.
And on the topics that you were discussing today about staggering the return to work or delaying the return to work, people working different hours or staying at working home, it's a good idea. You've been asking companies to go along with this. You've had some support. Could this possibly go to a matter of some sort of enforcement or some sort of official order to everybody stay working at home? Could you offer some sort of financing for setting up extra laptops or something like that, or possibly a tax credit for corporations? Is there anything you can do more than, asking nicely for people to go along with what seems like a good idea?
Well, I wouldn't rule anything out, both from the standpoint of the government or even more so perhaps the private sector itself, because I think in many cases they have made investments in laptops and things like that to facilitate working at home. But I think what's really gratifying about the efforts Mr. Raffi and I have been making to date with these companies and institutions is the incredibly positive response that we've had. We haven't had to even contemplate saying anything about having to even write them a stern letter. We just call and talk to them, and partly from their own self-interest because they have things they need to do with their workplaces and so on, but also I think out of a genuine sense of wanting to get this right. Those many workplaces that have signed up already have said yes. And I think today the plea that I'm making to other large employers to be in touch with us and tell us of their willingness to take part, I think we'll get a very handsome response to that. And that's going to be done in the way that we do things in Toronto. We do it because it's the right thing to do, not because somebody sent out a letter ordering anybody to do anything.
Okay, thank you for joining us, everybody. Please have a safe and
Brad, I
enjoyable
think
week.
so. I just want to make
Oh, I'm sorry. I apologize.
Sorry,
Sam.
Brad. I just wanted to
No,
add
go.
that the other response was they all are invested in the health and safety of the citizens of the city and their employees. And they wanted to have safe return of their employees, and telework is also working. And so I think that, just to echo the mayor's comments, that they were extremely willing and saw the corporate citizen aspect of it, but just their employees are also something they have to be concerned about, and that comes first for them, as it does for the city for its residents.
I will say as a finishing note on a Friday afternoon, I was unaware of all the bad habits that I had adopted when I was teleworking during my period of imposed isolation until I heard the doctors talk today. So people should get a better chair and get up and walk around, all of which I did not do on my period of compulsory isolation. I apologize.
You'll be forgiven, sir.
Thank you.
Okay, that's it. Thanks, everybody. We'll be back here Monday at 3:45.